private lab or a state lab?
State lab for the money.
Hi guys, welcome back to my YouTube channel. It's Vapa here. If you are new, I hope you like it here. I hope you stay and I hope you subscribe to our YouTube channel. So today we try to do something different. Actually, I interview medical laboratory science students about our profession. So I asked them what they like most, or like which department they prefer working in, their salary expectation, and what advice they can give to someone who want to do biomedical sciences. So if you want to hear more about biomedical sciences or medical laboratory sciences, or you have someone who want to do biomedical sciences, medical laboratory science, and this is actually the right video for you. So Tinta, what are you doing?
Okay, currently I'm culturing positive blood cultures on media plates.
Okay.
That's what I'm basically doing.
Okay. So tell me about this profession now. If someone wants to do biomedical sciences or medical laboratory sciences, what is all about?
Okay, so medical laboratory science is it's the back door of medicine. So what we do, we basically do diagnostics basically. So we receive samples from doctors, from hospitals, from clinics, and we are the ones who test the samples and basically check if there is bacterial growth now in microbiology, and we also test for tumor markers in chemistry, for example, leukemias, in hematology. So we are basically diagnostic scientists. We diagnose patients. Yeah.
Okay, so since you have been in almost every department, which department is your favorite?
Okay, I'm not gonna lie, but my favorite department is microbiology.
Oh.
Yeah, the reason why I'm saying it's my favorite is because it's, in my opinion, it's the most interesting. I get to see so many organisms and learn about so many organisms, and it's just interesting, like compared to the other departments. Not like I'm trying to bash the other departments, but yeah.
I think I understand you. From my side of story, I actually never liked microbiology when I was a student. I just fall in love when I started working in microbiology. But for you, you started loving microbiology while you are a student. That's actually good.
It's more interesting. You get to see so many interesting things and so many interesting cases as well.
Okay, that's good. All right, Tinta. So, Methuline. So now I'm seeing you guys are now in the lab since you came from outside. Tell me, what are you doing?
So I'm basically on sputum age.
Uh-huh.
That means that you receive respiratory tract samples, which include your sputum, your bronchial aspirates, your tracheal aspirates. What we do is we do microscopy, and then we also culture to see what organism the patient is infected with so that the doctor can make a diagnosis. So yesterday we planted out all the patient samples on blood agar as well as chalk and McConkey, and now we're just going to observe the growth and then record it on our working cards.
Okay, just open for me a BA plate. I want to ask something.
Okay.
Just open like.
Okay.
Okay, I'm seeing they said disc. Why do we put up that disc on the plate?
Okay, so on blood agar, what we usually try to rule out when we have sputum samples is strep pneumonia. So the optician disc is to check the sensitivity of strep pneumo to the antimicrobial. So since we can see that there's no zone formed around it, we can see that that is resistant, and we can therefore rule out strep pneumonia because it's sensitive.
Okay, so for those students that want to do medical laboratory science, what would you tell them about this course or the field?
I can for one say that it is a very interesting course. You learn a lot, especially if you're not interested in directly dealing with patients. It's a very interesting course. You learn a lot. It's not always that you interact with patients, but sometimes you do, especially like in other departments such as cytology or hematology, where you get to go for bone marrow transplants or bone marrow aspirations and so on. I would encourage everyone, to opt for it. You really do learn a lot. There's a lot of opportunities involved with it also. And yeah, I think we need a lot more people in laboratory medicine.
Yeah, and the other thing is when you do medical laboratory science, it's not really that you only need to work in a medical lab. You actually have other opportunities to work in other laboratory that are not related to medicine, because the course itself is broad.
Yes, exactly. So you could work in food as well. You could also work in breweries and so forth.
Yeah, that's correct. So tell me, since you've been in almost all the departments, which department is your most favorite and why?
Okay, so I think all of the departments have something special to bring. For instance, I wasn't really a fan of micro before, like in school, because I thought there was like a lot of theory and like how do I actually like apply and remember everything that I do. Since coming to the lab and actually working here, you actually get to apply your theoretical knowledge with the practical. And for instance, I am a visual learner, so the moment, like if I have to see like how something looks on the plate, then I think I'll always remember that, especially also for like our practicals and so on. But I think my favorite department, I think I have a lot of favorites actually. Hematology, cytology, histology. Yeah, those are all favorites. I can't really pick and choose which one because I think they all contributed like a lot.
Oh, okay. That's actually good. For me, when I was a student, I remember our first practical was on sputum smear, and I wasn't really comfortable. But as time goes, I realized that it's more like you need to get used, and then now until at the point where you consider that sputum as a sample, but not as spit, or like if you are in the lab, normally those samples, they look like they are samples, they are not disgusting. You guys understand?
Yeah, like stool.
So please introduce yourself.
Oh, hi guys, my name is Nyabino. Welcome to Bapa's channel.
Okay, so I'm just going to ask her a few questions. The first question, why did you apply for medical laboratory science?
So the thing is, like, I've always wanted to like help patients, but then like later on I figured like I can't do traumas, like I can't do patients, like directly, like I can't stand trauma. So I was like, yeah, like I needed something that where I will still be able to help patients, but not like come in contact with them like directly. So yeah, this was it for me.
I think that makes the two of us. Actually, like I wanted to become a doctor, but working with the patients every day, like I'll be crying with the patients. So working behind doctors was an option for me. Okay, so after you graduate, do you prefer working in a private lab or a state lab?
I don't know, like at this point, I feel like anything will do. You are also trying just to get like experience and all that. So whatever you get,
friends?
At this point, just to get that experience, and then you can now later on decide, okay, this is what I want. Yeah,
that's actually a good idea. Okay, so how much do you think a medical laboratory scientist gets paid?
Okay, I would say I have no idea, but it also depends on where you work, right? So, but I would think maybe around 30K. Okay, I don't know, but that's just me as making assumptions. I don't know.
Hi, Mimi.
Hi.
can you please tell me what you are doing?
Okay, so as you can see, so I set up my bench, my plate, and I even water just to read my bench. So these were cultured yesterday, and then the following morning we can take them out of the incubator. Some are incubated in CO2 and some are incubated in O2. So then you take them out and then you record findings on the patient card.
Okay.
And do the follow-up case that you for those in growth. Okay.
So what samples do you work with on this bench?
So this is this is a pass bench, but we also process things like catheter tips, tissues, actual specimens like retinal swabs.
We look for what in tissues?
Okay, bacteria, as well as yeast and
Okay. So for those people that want to do medical laboratory science, what will you tell them about medical laboratory science? What is all about medical laboratory science?
Okay, medical laboratory science is such an interesting course, like you say. So for somebody like me that you still want to help patients, want to help your patients, but like you don't want to work with them directly. Yeah. This is it. So you are literally helping to diagnose a patient and like helping the doctors to get the diagnosis so they can give the right treatment to the patients.
Oh.
This is it for you, if that's what you want.
Yeah, like if you want to work behind doctors but you don't want to work with patients directly. Okay, so since you have been at almost all the departments, which department is your favorite and why?
Okay, like for clinical pathology, I would say microbiology. I also love hematology, but I love microbiology more because like the other ones are more automated, so there's not really like a lot of manual. So yeah, it's usually instruments that do the work. But yeah, in microbiology you do a lot of interesting work. You get to see a lot of organisms and a lot of like tests, follow-up tests, and like, it's like so interesting. And then clinical pathology, I love histology more because like you get to see like a lot of interesting stuff like tissues, like all kinds of yeah.
All the sort of nice things.
Quite interesting.
Okay. It was nice having you, Mimi.
Oh, nice to meet you.
Why did you apply for medical laboratory science?
Okay, I applied for medical laboratory science. Unfortunately, because I got rejected for medicine. At first, it wasn't my passion. I actually didn't even know what this course was about. But getting into it, I now started to learn a lot about it. And so somebody just gave me advice that no, apply for this thing. It will be like a backbone for medicine. So that's why I applied for it initially. But so far, I've learned a lot of stuff and it's so interesting.
We should also share something in common. Me coming from the village, I didn't know what was biomedical sciences at the time. So my sister actually applied for me and I get to know the course when I was into it. Do you prefer working in a private lab or a state lab?
Okay, I think I'm open to anything, whether it's private, whether it's state, as long as I just get the necessary training, as long as I'm just competent and I'm enjoying myself and learning through the process. Yeah, I don't mind anything.
Okay, so what do you think a medical laboratory scientist get paid? You have seen people that are working, so how much do you think they get paid?
I'm looking at the cars they drive.
I think it's probably between 25,000 to 30,000. That's what I think.
Okay.
It's just a random guess.
No, it's fine. I wouldn't say you are close or that's right.
That's your thought.
But yeah, those are your thoughts.
Yes.
Okay, so thank you,
everyone. My name is Matthew Lean, and I am a medical laboratory science student.
Okay, so your first question is, why did you apply for medical laboratory science?
Why did I apply? I think I applied because I still wanted to be like within the medical sphere, and when I saw like it was like laboratory written, I was like, oh, that's so cute. Like I know it's like lab related and everything, and then I don't have to like be in contact with patients like 24/7. Actually, we don't keep in contact with patients most of the time, so that was good. Also because the emotional side towards me would just be like invested in the patients and like their well-being, that it would like strain my mental health and everything. So I was just like, let me rather do something else that I can also like avail myself to, but not have to try.
That's actually good. So do you prefer working in a private lab or a state lab?
State lab for the money. I'm kidding.
Guys, have you heard?
I'm kidding. I think I'd like to start off at like a private lab, because there's only like one state lab in Namibia, which is NIP. But starting off at a private lab, I feel like will do me well, and then gradually work your way up and then start in the States. That would also be nice.
That is actually a good idea. Like for myself, I started working in a private lab, but I started when I was a student. Like after school, I go there during holidays.
Okay,
I work
girl.
there. So when I graduated, I had enough experience, and I think I was competent enough to secure a job. Yes. Okay, so what do you think a medical laboratory scientist gets paid? How much do you think a medical laboratory scientist gets paid?
I would say 35 to 40K, depending on where you work, and then also like what you do in in what lab, in what department you work in. Like I think the cytotechnologist and the histotechnologist, they get paid a little bit more different than people working in core lab and so on. So I think 35 to 40K. Yeah, you can tell us.
You guys have heard. I won't say they are right or not, but yeah guys, this video was actually for those people that want to do medical laboratory science and they have no idea of what is medical laboratory science. So you guys have heard about the salaries and why they applied for medical laboratory science. Those information is good enough for you to make your decision. So I will see you in my next video.
Ciao.
You guys, you heard Mimi. Okay, it was nice having you on my YouTube channel, Mimi.
Oh, bye guys. Go subscribe to Papa's channel.
Thank you for having us on your channel. Don't forget to subscribe, like, and comment. And yeah, we'll see you guys.
Bye.
Bye.